How common is depression among older adults? And what are the signs and symptoms? How do we actually help older adults get connected to care? That's what I'll cover in this video. All right, so how common is depression among older adults? Well, the rates vary depending on the setting that older adults are living in and medical conditions and functional needs. About 1 to 5% of older adults living in the community experience depression. About 10% of older adults who are currently in the hospital experience depression, and about 13.5% of older adults who receive home health care or home health assistance. So that means that they have some need for somebody to assist them with aspects of their functioning, like maybe they need assistance taking a shower so they don't fall, or maybe they need assistance preparing meals. So the more a person needs assistance, the higher their risk of developing depression. So 13.5% of people, of older adults who have a home health aide or receive home health assistance have a depression disorder. And then when older adults live in senior residential communities, like a long-term care community, about 14 to 42% of older adults experience depression in those communities as well. So it's essential, no matter where you're living or what industry you work in, that you're aware of how often older adults are experiencing depression and then what you can do to help. So what is depression? Depression is a medical condition that affects more than 7 million older adults in the United States and is highly treatable. Changes in sleep can present a symptom of depression. Is your loved one sleeping too long or too little? Have they lost interest in activities that they enjoyed last year or a few months ago, and all of a sudden they're not interested in doing the activities that they once did? Are they experiencing feelings of despair or hopelessness or worthlessness? Are they feeling low energy or fatigued more easily than normal, or having more physical pain and physical symptoms? This is complicated because, as we talked about just a minute ago, older adults actually with medical conditions who might be receiving home health assistance or be in the hospital or just newly out of the hospital may have a lot of physical symptoms connected to a medical condition, and on top of that, experience depression as well. So don't wait until a medical illness is fully managed or cleared up. It's really important because there's such a high overlap between medical illnesses and mental health conditions that we help to target and treat the mental health condition so we can help improve the quality of life, even if the older adult is still living with a medical condition. So just keep that in mind. And changes in appetite, like eating too much or too little, any weight gain or weight loss, difficulty concentrating, like you can't stay focused on a task. I used to enjoy the crossword puzzle, but now I can't keep my mind on the page. Is the older adult withdrawing from activities and from social events that they used to enjoy, or friendships? Maybe they don't answer their phone as much. That's a sign of social withdrawal, and that could be concerning for depression. And then changes in how the body is moving. Is your loved one or the older adult more restless than normal? So like pacing and fidgety, or more still than typical. So if you notice a combination of these signs or are concerned, I'd encourage you to share your concerns with the older adult that's in your life. And be honest, be clear, and be compassionate, and encourage the older adult to get connected to care. Let's talk for a minute about what happens when older adults don't get the mental health care that they need when they have a depression. So when older adults are depressed and don't get any mental health care, if they have a medical concern, those medical concerns get worse. They tend to take more medication for their medical concerns. They have more visits to the ER, more hospitalizations. They stay longer in the hospital. Their caregivers tend to have more stress, and the risk for suicide increases. So it's essential that we are connecting older adults to mental health care when we see the signs and symptoms that they might be in need of mental health care. And just remember, Treatment for depression is just as effective for older adults as it is for younger adults. So if you're looking for a mental health provider for your older loved one or an older client or patient, you can find a mental health provider who specializes with older adults at www.mentalhealthandaging.com. You have an important role in helping older adults get the mental health care they need. Access to mental health care is one of the biggest reasons that older adults are not getting the mental health care they need. We don't want access to be a barrier. That's why we created the Center for Mental Health and Aging at mentalhealthandaging.com. Head on over there and learn more about mental health and aging and find a professional. Together, we'll make it easier for older adults and families to get the mental health care they need. If you see something and you're concerned, say something. Start the conversation and encourage the older adult to get care.